speak. If one of the biggest threats to your memory wasn't Napos, hiding in your genes, your diet, or even your age, but inside your medicine cabinet? Itandapos, the question that may sound alarming, yet Itandapos is one that researchers have been exploring for years. Millions of people take medications every day to manage allergies, anxiety, acid reflux, bladder problems, chronic pain, and insomnia. These medications can improve quality of life, relieve symptoms, and in many cases are absolutely necessary. But emerging research suggests that some commonly used medications, particularly when taken for long periods or in older adults, may be associated with an increased risk of cognitive decline and, in some cases, dementia. Before we go any further, Itandapos is important to understand one thing. This video is not telling you to stop taking your medications. In fact, doing so without medical guidance can be dangerous. Many of these medicines save lives or treat conditions that could become much worse if left unmanaged. Instead, this video is about awareness. It and APOS about understanding the latest scientific findings so you can have informed conversations with your doctor or pharmacist if you have concerns. As we grow older, our brains naturally become more sensitive to the effects of medications. A drug that caused no noticeable problems at age 40 may affect memory, concentration, or balance differently at 70. Itandapos, because aging changes the way our bodies absorb, break down, and eliminate medications. At the same time, many older adults take multiple prescriptions, increasing the possibility that drugs may interact with one another in unexpected ways. Researchers are especially interested in medications that affect the brain andapos, chemical messengers, interfere with healthy sleep, or contribute to long-term inflammation and other biological changes linked to cognitive health. While studies have found associations between certain medications and dementia risk, an association does not necessarily prove that the medication directly causes dementia. Other health conditions, lifestyle factors, and underlying illnesses can also play important roles. In today's video, Weandapos walk through 9 common types of medications that scientists have been studying closely. Weandapos will learn what the research actually says, who may be most at risk, and what practical steps you can take to protect your brain without putting your overall health at risk. By the end of this video, Weandapos be better equipped to ask the right questions, understand the potential risks, and make informed decisions together with your healthcare provider. Your memory is one of your most valuable assets, and knowing how your medications may affect it is an important step toward protecting your brain for years to come. Anticholinergic medications, the biggest concern for memory. When researchers talk about medications that may have the strongest connection to memory problems in older adults, one group appears in the conversation again and again: anticholinergic medications. These drugs are incredibly common. In fact, many people take them without even realizing the andapos ray classified as anticholinergics. Some are available by prescription, while others can be purchased over the counter for allergies, motion sickness, sleep problems, or bladder conditions. To understand why these medications have attracted so much scientific attention, we first need to understand a remarkable chemical in the brain called acetylcholine. Acetylcholine acts like a messenger between brain cells. It plays a critical role in learning, attention, memory formation, and even muscle movement. Every time you remember a loved andapos birthday, recall where you parked your car, or follow a conversation, in a crowded room. Acetylcholine is helping your brain process and store information. Unfortunately, one of the hallmarks of Alzheimer's disease is the loss of brain cells that produce acetylcholine. This is one reason why several medications used to treat Alzheimer's work by increasing the availability of acetylcholine in the brain. In other words, scientists already know that this chemical is essential for healthy thinking and memory. Anticholinergic medications do the opposite. They block the action of acetylcholine in different parts of the body. That can be extremely helpful for treating certain medical conditions. For example, reducing acetylcholine activity can ease an overactive bladder, relieve muscle spasms, reduce allergy symptoms, prevent motion sickness, or help people sleep. These are legitimate medical uses, and for many patients, the benefits outweigh the risks. The concern arises when these medications are used regularly over many months or even years, especially in older adults. Numerous observational studies have found that people with higher cumulative exposure to strong anticholinergic medications may have a greater likelihood of developing cognitive decline or dementia later in life. Researchers have also observed that the risk appears to increase with higher doses and longer durations of use. However, it's important to remember that these studies identify associations rather than proving direct cause and effect. People taking these medications may also have underlying health conditions that contribute to dementia risk. Still, the evidence has been strong enough that many geriatric specialists now recommend minimizing unnecessary anticholinergic medications whenever suitable alternatives are available. So, which medications fall into this category? One of the most familiar examples is certain older allergy medications. While they can be effective for reducing sneezing, itching, and watery eyes, some readily cross into the brain and may cause drowsiness, slowed thinking, and temporary memory difficulties. Many people assume that because these medicines are sold without a prescription, they must be completely harmless. But over-the-counter availability does not necessarily mean a medication is ideal for long-term daily use, particularly for older adults. Another common source of anticholinergic exposure comes from sleep aids. Many nighttime medications marketed to help people fall asleep contain ingredients with strong anticholinergic effects. Someone who struggles with occasional insomnia may begin taking one pill at bedtime, then continue using it night after night for months or even years without discussing it with a healthcare professional. Certain medications prescribed for overactive bladder also have anticholinergic properties. While these medicines can significantly improve quality of life by reducing urgency and frequent urination, they may also contribute to confusion or memory problems in some older adults. This doesn't mean everyone should stop taking them. Instead, it highlights the importance of regularly reviewing whether the medication is still necessary or whether newer options with fewer cognitive side effects might be appropriate. Some older antidepressants and medications used for dizziness, nausea, or gastrointestinal spasms may also contribute to what's known as the anticholinergic burden. This term describes the combined effect of taking multiple medications that each have anticholinergic properties. Even if each drug contributes only a small amount, the total burden can become significant when several are taken together. Imagine carrying a backpack. One small book may not feel heavy, but if someone keeps adding more books throughout the day, eventually the weight becomes difficult to manage. The same principle applies to anticholinergic medications. One medicine may have only a mild effect, but several together can place a much greater strain on the brain. Older adults are especially vulnerable because aging changes how medications are processed. The liver and kidneys often work more slowly, allowing drugs to remain in the body longer. Speak the protective barrier between the bloodstream and the brain may also become more permeable with age, making the brain more susceptible to medication effects. What symptoms should you watch for? Some people notice increasing forgetfulness that seems unusual for their age. Others develop difficulty concentrating, feel mentally slower, become unusually sleepy during the day, or experience episodes of confusion. Family members may notice that conversations become harder to follow, or that familiar daily tasks suddenly seem more challenging. Of course, these symptoms can have many different causes: poor sleep, infections, dehydration, vitamin deficiencies, depression, thyroid disorders, and early dementia itself can all produce similar changes. That tandapos, why a tandapos, so important not to jump to conclusions or blame a single medication without proper medical evaluation. If you andapos, concerned about your medications, one of the most valuable steps you can take is to schedule a medication review with your doctor or pharmacist. Bring every prescription medication, over-the-counter medicine, vitamin, and herbal supplement you use regularly. Healthcare professionals can identify medications with anticholinergic effects, evaluate whether they and APOs are still needed, and determine if safer alternatives are available. Sometimes the solution is surprisingly simple. A newer allergy medication may control symptoms without affecting the brain as much. A different bladder medication might provide similar benefits with fewer cognitive concerns. In other cases, lifestyle changes or non-drug therapies may reduce the need for certain medications altogether. Itandapos. Equally important to remember that not everyone experiences memory problems from anticholinergic medications. Many people take them for short periods without any lasting issues. The greatest concern generally involves long-term use, higher cumulative doses, older age, and taking several anticholinergic medications at the same time. The key message is nandapos, to fear these medications, itandapos, to use them thoughtfully. Medicines are powerful tools, and when chosen carefully, they can dramatically improve health and quality of life. But like every medical treatment, they should be reviewed periodically to ensure that their benefits continue to outweigh their risks. Protecting your brain does nandapos always mean adding another supplement or following the latest health trend. Sometimes it begins with taking a closer look at the medications you andapos are already using and having an open, informed conversation with the healthcare professional who knows your medical history best. Sleep medicines, anxiety drugs, and their impact on the aging brain. After anticholinergic medications, another group of drugs has received significant attention from researchers studying brain health and dementia risk. Medications used to treat anxiety and insomnia. For millions of people, these medicines provide much needed relief. They can calm overwhelming anxiety, ease panic attacks, and help someone finally get a full night andapos, sleep after weeks or even months of insomnia. When used appropriately and under medical supervision, they can be incredibly beneficial. However, the question researchers have been asking is this: what happens when these medications are used continuously for months or years, especially in older adults? One of the most commonly discussed groups is benzodiazepines. This class includes medications often prescribed for anxiety, panic disorders, muscle spasms, and insomnia. They work by enhancing the activity of a calming brain chemical called GABA, which slows down nerve activity. This calming effect is exactly why these medications can reduce anxiety so effectively and help people fall asleep more quickly. But the same effect that calms the brain can also slow down important mental processes. Many people notice that shortly after taking a benzodiazepine, they feel sleepy, relaxed, or less alert. Some experience difficulty concentrating or remembering conversations that happened while the medication was active. These short-term effects are well known and are listed among the possible side effects of these medications. The bigger concern is whether long-term use may contribute to lasting cognitive decline. Over the past 2 decades, numerous observational studies have explored whether prolonged benzodiazepine use is associated with an increased risk of dementia. Some studies have reported a higher risk among long-term users, while others have found little or no clear association after accounting for other health factors. Because of these mixed findings, scientists have not concluded that benzodiazepines directly cause dementia. Instead, the current evidence suggests that long-term use may be one of several factors that could contribute to cognitive decline in certain individuals, particularly older adults. One reason the research is so challenging is that anxiety and sleep disorders themselves may be early signs of neurodegenerative disease. In other words, some people may begin taking these medications because subtle changes in the brain are already occurring years before dementia becomes noticeable. This makes it difficult to determine whether the medication increases the risk or whether the underlying condition is the true cause. Even so, most geriatric specialists agree on one important point. Older adults are generally more sensitive to the effects of benzodiazepines. As we age, our bodies metabolize these medications more slowly. A dose that wears off overnight in a younger adult may remain in an older person's system well into the next day. This can lead to daytime drowsiness, slower reaction times, poor balance, and impaired judgment. These effects are more than just inconvenient. They can significantly increase the risk of falls, fractures, and hospitalization. A serious fall can reduce mobility, lead to prolonged bed rest, and indirectly affect cognitive health by limiting physical activity and social engagement. Another issue is dependence. Unlike many medications that can simply be stopped when no longer needed, benzodiazepines may cause withdrawal symptoms if discontinued suddenly after long-term use. People may experience increased anxiety, insomnia, irritability, tremors, or, in severe cases, seizures. This is why healthcare providers usually recommend gradually tapering the medication rather than stopping it abruptly. Another category worth discussing is prescription sleep medications, sometimes called Z-drugs. These medications are commonly prescribed for insomnia and are often viewed as an alternative to benzodiazepines. While they work differently, they also affect brain activity involved in sleep and alertness. These medications can be very effective for short-term treatment of insomnia. However, they may still cause side effects such as next-day drowsiness, confusion, impaired coordination, and unusual nighttime behaviors like sleepwalking or performing activities without full awareness. Research examining their long-term relationship with dementia has produced mixed results. Much like the research on benzodiazepines, some studies suggest a possible association with increased cognitive decline, while others do not demonstrate a direct causal link. Because uncertainty remains, many experts recommend using these medications at the lowest effective dose and for the shortest duration necessary. Ironically, one of the best ways to protect the brain is not simply by taking sleep medication, it's by achieving healthy, restorative sleep itself. During deep sleep, the brain performs essential maintenance. It strengthens memories, repairs cellular damage, regulates hormones, and helps remove metabolic waste products through a network known as the lymphatic system. Scientists believe this system becomes particularly active during deep sleep, helping clear proteins such as beta amyloid that are associated with Alzheimer's disease. When sleep is consistently poor, these natural cleaning processes may become less efficient. Chronic sleep deprivation has been linked to impaired memory, reduced concentration, mood disorders, and a greater risk of cognitive decline over time. This creates a difficult balance. People need quality sleep to maintain brain health, but relying indefinitely on certain sleep medications may also have potential drawbacks. That's why healthcare providers increasingly encourage addressing the underlying causes of insomnia whenever possible. Sometimes poor sleep results from untreated sleep apnea, chronic pain, depression, medication side effects, excessive caffeine, irregular sleep schedules, or stress. Treating these underlying problems may improve sleep without requiring long-term medication. One of the most effective non-drug treatments for chronic insomnia is cognitive behavioral therapy for insomnia, often called CBTI. This structured program helps people develop healthier sleep habits, change behaviors that interfere with sleep, and reduce anxiety surrounding bedtime. Research has shown that CBTI can produce long-lasting improvements and is often recommended as a first-line treatment for chronic insomnia. Simple lifestyle habits can also make a meaningful difference. Maintaining a consistent bedtime and wake-up time helps regulate the body's internal clock. Avoiding large meals, alcohol, and excessive caffeine close to bedtime may improve sleep quality. Limiting screen exposure during the hour before bed reduces exposure to blue light, which can interfere with the production of melatonin, the hormone that signals the body it's time to sleep. Regular physical activity also plays an important role. Even a daily walk can improve sleep quality, reduce anxiety, and support overall brain health. Exposure to natural daylight during the morning further strengthens healthy sleep-wake cycles. If you're currently taking medication for anxiety or insomnia, this information should not be interpreted as a reason to stop treatment on your own. Many people benefit greatly from these medications, particularly during periods of severe anxiety, acute stress, or temporary insomnia. The goal is not to create fear, but to encourage informed decision-making. A productive conversation with your healthcare provider might include questions such as, is this medication still necessary? Could a lower dose be effective? Are there newer options with fewer cognitive side effects? Could non-medication strategies be added to reduce long-term reliance on the drug? These discussions allow treatment plans to evolve as your health changes over time. Ultimately, protecting your brain isn't about avoiding every medication. It's about finding the safest, most effective balance between managing today's symptoms and preserving tomorrow's cognitive health. When medications are used thoughtfully, monitored regularly, and combined with healthy lifestyle habits, It's possible to care for both your immediate well-being and your long-term memory at the same time. Acid reflux medicines, painkillers, and other surprising medications. When most people think about medications that could affect memory, they usually picture sleeping pills or medicines for anxiety. Very few would suspect that medications for heartburn, chronic pain, muscle spasms, or even seizures have also become topics of scientific investigation. Yet over the past several years, researchers have examined whether some of these commonly used medications might influence long-term brain health, especially when taken for extended periods. It's important to begin with an important reminder. Many of these medications are highly effective and often medically necessary. They help people control serious health conditions, relieve chronic pain, prevent seizures, or heal stomach ulcers. The goal isn't to create fear or encourage anyone to stop treatment. Instead, it's to understand what researchers have discovered and why regular medication reviews are becoming increasingly important as we age. Let's begin with one of the most commonly used medications in the world, proton pump inhibitors, often called PPIs. These medications are prescribed to reduce stomach acid and are commonly used to treat acid reflux, stomach ulcers, and gastroesophageal reflux disease, or GERD. They are very effective at allowing irritated tissues in the esophagus and stomach to heal. And for many people, they dramatically improve quality of life. Several years ago, some observational studies suggested that people taking PPIs for long periods appeared to have a higher rate of dementia. These findings received widespread media attention, leading many people to worry that their heartburn medication might damage their memory. However, the story turned out to be more complicated. As more studies were conducted, the evidence became mixed. Some large studies continued to observe a possible association, while others found no meaningful increase in dementia risk after adjusting for age, medical conditions, and other medications. At present, scientists have not established that PPIs directly cause dementia. Most experts believe that if there is any risk, it is likely to be small and influenced by many other health factors. Even so, doctors generally agree that PPIs should be used at the lowest effective dose and for the appropriate duration. Some people continue taking them for years simply because they were never advised to stop after the original problem resolved. Others may benefit from lifestyle changes such as weight management, avoiding large late-night meals, limiting alcohol, reducing highly acidic foods, and elevating the head of the bed, allowing them to reduce their dependence on long-term acid-suppressing medication under medical supervision. Another group of medications researchers continue to study is opioid pain medications. These drugs are extremely important for treating severe pain after surgery, cancer-related pain, and certain acute injuries. For some patients with chronic pain, they remain an essential part of treatment. But opioids also affect the central nervous system, slowing brain activity and altering the way pain signals are processed. Anyone who has taken an opioid knows that drowsiness, slower thinking, and reduced concentration can occur, especially when first starting treatment or after a dose increase. In older adults, these effects may be even more pronounced. Long-term opioid use has been associated with changes in attention, memory, and executive function in some studies. Researchers are still investigating whether prolonged exposure contributes to lasting cognitive decline or whether the underlying chronic pain itself is responsible for many of the observed changes. Chronic pain places enormous stress on the brain, and can interfere with sleep, physical activity, and mood, all of which influence cognitive health. This highlights an important principle in medical research. Sometimes the illness being treated contributes to dementia risk, making it difficult to separate the effects of the medication from the effects of the condition itself. Whenever possible, healthcare providers often use a multimodal approach to pain management, depending on the cause of the pain. This may include physical therapy, exercise, weight management, mindfulness techniques, heat or cold therapy, and other non-opioid medications. For many people, combining several strategies can reduce the amount of opioid medication needed while still providing meaningful pain relief. Next are muscle relaxants, another category that often flies under the radar. These medications are commonly prescribed for back injuries, muscle spasms, and neck pain. Many have sedating properties and can cause dizziness, confusion, or slowed thinking, particularly in older adults. While they can be very helpful during short periods of acute muscle injury, prolonged use may increase the risk of falls and cognitive side effects. Similarly, certain anti-seizure medications, also called anticonvulsants, have been linked to temporary difficulties with attention or memory in some individuals. These medicines are essential for controlling epilepsy and may also be prescribed for nerve pain or mood disorders. Newer anticonvulsants generally have more favorable cognitive profiles than some older medications, but every patient responds differently. Neurologists carefully balance seizure control with potential side effects when selecting the most appropriate treatment. Another often overlooked source of cognitive side effects is older antihistamines. Many people keep these medications in their medicine cabinet to treat seasonal allergies or occasional itching, because some of these drugs also cause drowsiness. The andipose, a frequently included in nighttime cold medicines and over-the-counter sleep aids. As discussed earlier, several older antihistamines have anticholinergic properties, meaning they can interfere with acetylcholine, a brain chemical essential for learning and memory. This becomes particularly important because many people unknowingly take several medications containing similar ingredients. A nighttime cold medicine, an allergy tablet, and a sleep aid may all contribute to the same overall anticholinergic burden. This brings us to one of the most important concepts in caring for older adults: polypharmacy. Polypharmacy simply means taking multiple medications at the same time. Etandipose, incredibly common. Many adults over the age of 65 take 5 or more prescription medications every day, not including vitamins or over-the-counter products. Sometimes every medication is necessary and appropriate. However, each additional medication increases the possibility of side effects, drug interactions, and cumulative effects on the brain. Imagine trying to have a conversation in a crowded room. One person talking in the background might not distract you very much, but if 5 or 6 people begin speaking at once, it becomes increasingly difficult to focus. The aging brain faces a similar challenge when processing the combined effects of numerous medications. This is why experts recommend a comprehensive medication review at least once a year, especially for older adults or anyone taking several prescriptions. During these appointments, healthcare providers evaluate whether each medication is still needed, whether the dosage remains appropriate, and whether safer alternatives have become available. Patients can also play an active role in protecting their brain health. One simple habit is keeping an up-to-date medication list. Include prescription drugs, over-the-counter medicines, vitamins, herbal supplements, and even medications taken only occasionally. Bring this list to every medical appointment so each healthcare provider has a complete picture of what you and APOs taking. ITAN APOs also helpful to ask thoughtful questions such as, and what, do I still need this medication? And what, is this the lowest effective dose? And what, are there newer alternatives with fewer side effects? And what, could any of my medications be affecting my memory or concentration? And quote. These conversations don't endapos challenge your healthcare provider. They strengthen your partnership in making informed decisions. Aitandapos, equally important to avoid assuming that anquat natural anquat products are automatically safer. Herbal supplements can also interact with prescription medications or produce side effects of their own. Always tell your doctor or pharmacist about every product you take, regardless of whether it requires a prescription. Speak. The overall message from current research is reassuring. Most medications do not guarantee memory loss or dementia, and for many people, the benefits of treatment far outweigh the potential risks. What matters is using the right medication at the right dose for the right amount of time, while regularly reviewing whether it continues to be the best option. Modern medicine has dramatically increased life expectancy and improved the quality of life for millions of people. The goal isn't to fear medications, it's to use them wisely. By staying informed, reviewing medications regularly, and maintaining open communication with your healthcare team, you can continue benefiting from today's treatments while also taking meaningful steps to protect your brain health for the future. Protecting your brain while taking necessary medications. After learning about several types of medications that researchers have linked to memory problems or a possible increase in dementia risk, you may be wondering what you should do next. Should you stop taking your prescriptions? Should you throw away your sleep medicine or heartburn medication? Should you worry every time you take a pill? The answer is no. The most important lesson from today's discussion is that medications are not the enemy. In fact, many of them save lives every single day. Blood pressure medications reduce the risk of stroke. Diabetes medications help prevent damage to the heart, kidneys, eyes, and nerves. Antibiotics fight dangerous infections. Pain medications can restore mobility and improve quality of life. The goal is not to avoid medications altogether. It is to use them as safely and effectively as possible. One of the best ways to protect your brain is surprisingly simple. Schedule regular medication reviews with your healthcare provider. Many people continue taking medications simply because they were prescribed years ago, even though their medical condition has changed. A medicine that was essential 5 years ago may no longer be necessary today. Likewise, newer medications may now be available that offer similar benefits with fewer effects on memory or thinking. During a medication review, your doctor or pharmacist carefully evaluates every medication you take, including prescriptions, over-the-counter medicines, vitamins, herbal supplements, and even occasional sleep aids or allergy pills. They look for unnecessary duplication, medications that may interact with one another, and drugs that could potentially affect cognitive function. This type of review becomes especially valuable after the age of 60 because the body's ability to process medications gradually changes over time. The liver and kidneys, which help break down and remove medications, often become less efficient with age. As a result, medications may remain in the body longer, increasing the likelihood of side effects. Even medications that were well tolerated for years may begin affecting concentration, balance, or memory differently later in life. Another important strategy is to keep an accurate and updated medication list. This sounds simple, but many people forget to include over-counter products because they don't think of them as real medications. Yet allergy medicines, nighttime cold remedies, sleep aids, acid reflux tablets, pain relievers, and herbal supplements can all interact with prescription drugs or contribute to unwanted side effects. Carry your medication list in your wallet or store it on your smartphone. Include the name of each medication, the dose, how often you take it, and why you take it. This information can be invaluable during medical appointments or emergencies. Of course, medications are only one piece of the brain health puzzle. Research consistently shows that lifestyle habits have a profound influence on cognitive health throughout life. While no single habit can completely prevent dementia, combining several healthy behaviors appears to provide meaningful protection. Let's begin with nutrition. Many experts recommend a Mediterranean-style eating pattern because it emphasizes foods associated with healthy aging. Fresh vegetables, colorful fruits, beans, lentils, whole grains, nuts, seeds, olive oil, and fatty fish provide nutrients that help reduce inflammation and support healthy blood vessels. The brain depends on an extensive network of tiny blood vessels to deliver oxygen and nutrients. Keeping those vessels healthy supports memory, learning, and overall cognitive function. At the same time, limiting highly processed foods, excessive added sugars, and unhealthy fats may help reduce chronic inflammation, which researchers believe plays a role in many age-related diseases. Physical activity is another powerful tool for protecting the brain. You don't need to become a marathon runner to experience the benefits. Even moderate activities like brisk walking, swimming, cycling, dancing, or gardening can improve circulation, reduce blood pressure, and stimulate the release of growth factors that help maintain healthy brain cells. Strength training is equally important, especially for older adults. Maintaining muscle mass improves balance, reduces the risk of falls, supports healthy metabolism, and encourages continued independence. Studies have even shown that resistance exercise may improve certain aspects of memory and executive function. Sleep also deserves special attention. During deep sleep, the brain consolidates memories, repairs cells, and clears away metabolic waste products. Chronic sleep deprivation has been associated with increased cognitive decline, mood disorders, and reduced concentration. Instead of relying solely on medications, try developing consistent sleep habits. Go to bed and wake up at the same time each day. Keep the bedroom cool, dark, and quiet. Avoid heavy meals and excessive caffeine before bedtime, and limit screen time during the hour before sleep. Mental stimulation is another essential ingredient in lifelong brain health. The brain thrives when it is challenged. Reading books, learning a new language, solving puzzles, practicing a musical instrument, or developing a new hobby all encourage the brain to form new connections. Just as muscles become stronger through exercise, the brain benefits from regular mental activity. Social engagement matters just as much. People who maintain strong relationships with family, friends, neighbors, or community groups often experience better emotional well-being and healthier cognitive aging. Meaningful conversations, shared activities, volunteering, and staying connected help stimulate multiple areas of the brain while reducing loneliness and chronic stress. Managing chronic medical conditions is equally important. High blood pressure, diabetes, high cholesterol, obesity, and smoking all damage blood vessels throughout the body, including those that supply the brain. In fact, many cases of cognitive decline are influenced not only by Alzheimer's disease, but also by vascular damage caused by years of uncontrolled cardiovascular risk factors. Keeping blood pressure within a healthy range, controlling blood sugar, maintaining healthy cholesterol levels, and avoiding tobacco use all support better brain health. It's also important to recognize early warning signs that deserve medical attention. Occasionally forgetting where you left your keys is common, especially during busy or stressful days. However, consistently forgetting familiar names, repeating the same questions, becoming lost in familiar places, struggling with routine tasks, or experiencing noticeable personality changes should never be ignored. Speak Early evaluation allows healthcare providers to identify reversible causes of memory problems, such as vitamin deficiencies, thyroid disorders, medication side effects, depression, or sleep apnea. When dementia is present, early diagnosis also provides more opportunities for treatment, planning, and support. One of the most valuable habits you can develop is asking questions. The next time your healthcare provider prescribes a new medication, consider asking, "And what? Why do I need this medication? And what? And what? How long should I take it? And quote, are there any effects on memory or concentration that I should watch for? And quote, are there non-medication approaches that might also help? And quote. These questions encourage shared decision-making and ensure that your treatment plan reflects both your immediate health needs and your long-term cognitive goals. Perhaps the most reassuring message is this: protecting your brain is rarely about one single decision. Itandapos, the result of hundreds of small choices made consistently over time. Eating nutritious meals, staying physically active, sleeping well, challenging your mind, maintaining strong social connections, controlling chronic diseases, and reviewing your medications regularly all work together to support healthy aging. No one can eliminate every risk for dementia, but everyone can take meaningful steps to improve the odds of maintaining a sharp, active mind for years to come. By partnering closely with your healthcare team and staying informed about your medications, Euandapos, giving your brain one of the greatest gifts possible, the opportunity to age as healthfully and independently as it can. Your brain deserves the best care. If there Andapos, one message I hope you take away from Tudayandapos, video Itandapos, this: knowledge is one of the most powerful tools for protecting your brain. We often think about memory loss as something dandapos, completely out of our control, but the truth is that many everyday choices can influence our long-term brain health. Understanding your medications is one of those choices. Tudayandapos, discussion wasandapos, meant to create fear or make you question every prescription in your medicine cabinet. Quite the opposite. Modern medications have helped millions of people live longer, healthier, and more comfortable lives. They treat chronic illnesses, relieve pain, control dangerous medical conditions, and, in many cases, save lives. The goal is never to stop taking medications on your own. Instead, Itandapos, to become an informed partner in your healthcare journey. Remember, the research Weandapos It discussed points to possible associations between certain medications and an increased risk of cognitive decline in some people, particularly with long-term use or in older adults. But association does not necessarily mean causation. Every person and Apo's health situation is unique, which is why decisions about medications should always be made together with a qualified healthcare professional who understands your medical history. If this video encouraged you to think differently about your medications, consider taking one simple step this week. Gather all of your prescription medications, over-the-counter medicines, vitamins and supplements, and schedule a medication review with your doctor or pharmacist. It could be one of the most valuable conversations you have for your long-term health. Sometimes a small adjustment is all that Tandapos. It needed to reduce unnecessary risks while still getting the treatment you need. I also encourage you to share this video with your family and friends, especially parents, grandparents, or anyone who takes several medications every day. Many people have never heard about the concept of medication-related cognitive risk, and this information could help someone ask important questions during their next medical appointment. Iendapos. Also love to hear from you. Which medication surprised you the most? Was there anything you learned today that you hadn't heard before? Speak. Share your thoughts or experiences in the comments below. While everyone's situation is different, your questions and discussions can help others become more informed and encourage meaningful conversations about healthy aging. If you enjoy evidence-based health content focused on nutrition, longevity, brain health, and the latest medical research, make sure to subscribe and turn on notifications so you never miss a future video. Every week, we explore practical, science-backed strategies that can help you protect your health, stay active, and age with confidence. Thank you so much for watching and for investing your time in your health today. Remember, protecting your memory isn't about finding one miracle pill or one perfect solution. It's about making informed decisions, building healthy habits, and working closely with your healthcare team every step of the way. Until next time, stay curious, stay healthy, and take great care of both your body and your brain, because the choices you make today can help shape the memories you'll cherish tomorrow.